January is Birth Defects Awareness Month, and according to the CDC, 1 in 20 babies in Colorado are born with a major birth defect. While not all can be prevented, there are steps that parents-to-be can take to increase the chances of having a healthy baby. So joining me now is Dr. Susan Ulmer, an OBGYN at Women's Care of Colorado at Skyridge. And Dr. Ulmer, can you tell us more about birth defects and what are some common defects and their causes?
So a lot of the birth defects that we see, unfortunately, we don't have any way of knowing about them. They're just kind of an unknown cause. Some of the most common ones that we see are heart defects, cleft lip, cleft palate, limb defects, and then the one that a lot of people are very familiar with, of course, is Down syndrome as well. They occur in general, birth defects usually occur about 2 to 4% of the time in birth.
Interesting. And how can women prepare for a healthy pregnancy?
Well, one of the best ways that they can do that is just being healthy themselves and practicing a healthy lifestyle, getting themselves to a healthy body weight, maintaining a well-balanced diet, making sure that any of their underlying illnesses are well managed and well controlled, things like diabetes and any asthma, thyroid disorders. Other things that they can do would include just taking a prenatal vitamin, and having that on board before they get pregnant is very important. One of the elements of a prenatal vitamin, in particular folic acid, actually has a lot of benefit in preventing things like neural tube defects, so things like spina bifida, or a hole somewhere along the spine. And having those important elements on board before you get pregnant can actually help prevent birth defects later on.
Interesting. I know you said some of these aren't known, but what are some steps women can take during their pregnancy to possibly prevent birth defects? I know you covered a few ideas, but...
Yeah, so healthy lifestyle, taking a prenatal vitamin, avoiding, things like tobacco, alcohol, environmental exposures that sometimes can cause birth defects. The other thing that they can do is actually, we do offer appointments or preconception appointments with our patients, and just talking with their doctor about certain things that might be red flags in their history or their family history for a potential future birth defect, and things that we can do to screen for those things for them, or how we can tailor their care to help prevent those.
Great. Yeah, that's a great resource for parents. Is there any other resources for parents-to-be who are concerned about this that you would recommend them check out?
One of my best resources is actually ACOG, or the American College of Obstetrics and Gynecology. And as an OBGYN, I use that a lot, but they actually have a wonderful area just for patients in general that provides a lot of information. And it's a wonderful resource where they don't, necessarily get lost in the lists of Google and forums. And it's just great evidence and great advice there.
That's great. I'm sure it can be overwhelming at sometimes to many people. Is there anything we haven't talked about that you want parents to know or think about?
I think just knowing that when you're getting ready for a pregnancy, the number one thing that you can do is just being healthy yourself, making sure that you are in a good both physical and mental state of health going into it. It'll make your pregnancy a lot easier on you as well as the baby. But I think just, being open with your doctor as well about things that you're concerned about, things that you have questions about, and asking if you have any concerns in the meantime.
Well, thank you, Dr. Ulmer, so much for joining us. We'll be right back.